Hey, Dr. Karan here. In this video, I am going to discuss depression among dementia patients. I have a patient who is 90 years old, and he moved from one state to other because of his living situations, and his kids, they're late 60s and 70s, they live in California, and um, they brought him here. I saw him recently, and he is avid golfer, and he plays golf almost every day. Um, but when he was living in other state, he was in love with a woman for 20 years, but she herself is in her 90s, and she is in the memory care, um, totally dependent on somebody to take care of her. Apparently, he was involved in her care, but his kids thought he couldn't really do that himself anymore. So, for his safety, he was brought to California, and so he has dementia, Alzheimer's kind, but he is also, with the help of his kids, quite active. I wanted to talk about depression in dementia patient. It's very common in people living with dementia because, and thing is that most of the people have a hard time recognizing it because lots of symptoms overlap, and it looks very different from depression in young age and younger people. Um, and recognizing it early can make a huge difference in comfort, behavior, and quality of life. So, what are the common symptoms of depression and dementia? Emotional and behavioral signs. There will be persistent sadness, tearfulness, flat mood, loss of interest in activities they once enjoyed, social withdrawal, refusing to engage, refusing to eat, irritability, agitation, frequent anger, anxiety or excessive fear without any reason. Definitely poor appetite and weight loss, sleep problem, insomnia, or sleeping too much, low energy, slowed movement all of a sudden, neglect of personal hygiene, and they have a cognitive and psychological clues like there'll be more increased confusion, um, and they will make hopeless and negative statements and repetitive expression of worthlessness or guilt. And thing is that lots of people at this age and with this disease, they cannot describe sadness very clearly. So depression may act more like agitation, uh, apathy, and withdrawal instead. Um, because symptoms itself overlap with dementia, and these folks are not able to express their emotions, you know, and family usually feel that this is just a part of dementia aging, but it is not. So how to handle depression in dementia patient? Non-drug therapy, first line and very effective. They should always come first. A structured daily routine, it will reduce anxiety. Gentle physical activity, walking, chair exercise, music therapy, especially familiar song, um, reminiscence therapy, talking about past memories, showing pictures, photos, videos, sunlight exposure, that will improve mood and sleep. Consistent caregivers, that builds emotional safety. Small changes done daily often work better than medicine. And medication, when depression is moderate to severe, the most common used medication for dementia patient is sertraline, which is Zoloft, a small dose. I usually try 25 milligram, citalopram 5 milligram or 10 milligram. So start low dose, go slow, monitor closely for any confusion falls, and and you should always avoid sedating medication. Always check for other triggers like arthritis, pain, dental pain, bladder infection, medicine side effect, loneliness or sensory deprivation. Um, and sometimes just fixing the trigger may resolve depression without antidepressant. And support for caregivers. Um, so it's really important that caregivers also get respite care and support groups. Um, a calm caregiver will make patient calmer. It's really important. Depression, dementia is real, common, and treatable. It often hides behind behavioral changes, not words. With early recognition and non-drug strategy and careful medical support, patients can live with less distress and better quality of life. So thank you for watching. By the way, family member of this patient will fly that patient one time to so that he can see her companion maybe for the last time and maybe able to say goodbye. So I hope that will help and bring closer. Thank you for watching.